the prize for having learned how not to cry.
7:22. Dan Buck sitting in for McGraw Millhaven. Aaron O'Neill Hayes sitting in for Kelly Jackson. We're having a lot of fun on your Friday morning, and the show's flying along.
It doesn't it?
It does.
Every time I come here, it's like it's not one of these jobs where you look at the clock thinking, "Oh my God!" I mean, it just moves.
Well, after spending my past 5 years in the healthcare industry, working for a local health hospital, I've really gained an appreciation for medicine and what doctors are doing and how we're advancing. But I have a great respect for Mercy locally, and we're thrilled to be able to call St. Louis home for the Mercy Health System. But they are moving upstream so fast. When I say upstream, I mean they are looking up to the preventative. What can we do to prevent things from happening and getting people well and trying to keep them from coming into our hospitals? And one example of that is what's going on at their heart hospital. Some remarkable work. And we have with us in studio one of their top cardiologists, Dr. Jeffrey Saramita. And first of all, welcome to the show, Doctor. How are you?
Thank you. Thank you very much for having me this morning.
I just want to applaud Mercy as a system, number one, but you and your fellow cardiologists and cardiothoracic surgeons that you have there at the heart hospital for the work you're doing on the preventative side. And you are here to tell us about two pretty big new devices that are helping you do a better job of keeping people well.
Yes, we have a lot of exciting, I'd call them new adventures in the world of cardiology. Mercy's investing millions of dollars into preventive care in the cardiovascular world. Namely, there's two new procedures that we've been approved to do, first in the region and only centers in the region, including the city of St. Louis. One of them is the CardioMEMS device. This is a small catheter that is less than 1 centimeter in length, less than the size of your fingertip, that's implanted in the pulmonary artery. And what's fascinating about this device is it takes less than 10 minutes to implant in an outpatient procedure, and this wirelessly transmits data from your heart regarding your fluid levels to your cardiologist's cell phone.
Oh my!
Through
To
an
his
iPad,
cell phone. That's incredible.
through an iPhone app. And your cardiologist can daily adjust water pills, also known as diuretics, to ensure you stay out of the hospital.
Oh my goodness!
It's incredible.
Incredible technology.
Do you have I think for the folks who are watching streaming online,
Yes, it's
look at
really
look at
hard
this.
to
Look at the
see.
size of that, Aaron.
Don't drop
Look at
it.
that thing. I know.
We won't be able
would
to
never
find it.
find it
Really
again.
hard to see.
It's
Less than
almost
1 centimeter.
microscopic. Yeah, it's pretty cool.
Yeah, and studies have shown up to a 37% reduction in hospitalization from congestive heart failure. And of course, that's the big area of focus these days because we haven't improved enough in our congestive heart failure realm.
Wow. And then the other device that you brought along, what is that all
The
about?
secondary device might be even more exciting. At least 6 million Americans are affected with an irregular heart rhythm known as atrial fibrillation.
My wife has
My
it.
mother has it.
There you go.
And of course, the number one danger with atrial fibrillation is your stroke risk. And we see a lot of attention put on blood thinners these days, especially with the advent of 4 new oral anticoagulants to overtake the warfarin world that we've had for decades. The problem with all of those blood thinners is that they do pose an increased bleeding risk, and this is a known true risk. This device right here is called the Watchman Device, again, the size of about 1 centimeter, and this is a little plug that goes inside the heart in the area most commonly attracting blood clots, and actually can be used as a replacement for blood thinners. This was just approved by the FDA this year after years of scrutiny and vetting. But the fun part about this is Mercy was one of the 10 largest centers in the United States enrolling on the research realm from this. So we have a lot of experience implanting this device. Our outcomes are really great, and it gives a fascinating alternative to patients who otherwise are not great candidates to take those dangerous blood thinners at times.
Give me a practical, how do I as the consumer use this, and how does it change the way in which I can monitor?
This would be a patient who has atrial fibrillation. The cardiologist recognizes the danger of stroke and says you really need to be on a blood thinner. For a number of reasons, the patient might be hesitant to be on a blood thinner. There might be problems with bleeding already in that patient. This can be implanted and used immediately as an alternative
So this
to
replaces
blood thinners
blood thinners.
for
So
the
they could
rest
be
of their
off-
life.
Wow.
Off blood thinners.
Goodness.
Wow.
Off blood thinners for the rest of their life. And the FDA has noted that it has equal in efficacy, at least, maybe even superior, but at least equal to blood thinners in reducing your risk of stroke.
Wow. And and this remarkable to me is that you are making this investment, you are making the strides in these areas that reduce your income.
Yeah.
And no, I'm serious.
you're
I mean,
right. Everyone-
I have been dumbfounded over the years that healthcare is not in the preventative healthcare measure, and it's really because of business. It's because there's no money. You can't bill for a lot of this stuff more than the normal, and what you're doing is you're reducing the frequency of those visitors coming back to you, right?
Well, you were exactly right. So in the CardioMEMS realm, ironically, as often happens, we don't get paid by Medicare yet because it's a new technology. And so until October of this year, we won't know if we get paid for this or not.
Really?
But it's part of the investment in this preventive care. Mercy is an accountable care organization, which, to simplify it down, means we want to provide better care at cheaper costs. And in the end, then everyone wins.
Yeah.
And you were saying this reduces the number of people who even just walk into a hospital.
Yes. So what we want to do is catch the fluid levels as they start to rise, attack them then, easier on the kidneys, easier on the heart. If you can stop that train before it gets going, that's your only opportunity for success.
Why do we hear more about blood clots these days, it seems? I mean, I hear people who can't even fly on a plane, or they have to take certain, steps before they can fly.
Yeah, unfortunately, blood clots are a real entity that we just haven't been great about. Is that whether it's an irregular heart rhythm, whether it's obesity and problems with veins, there is a number of medical entities we just haven't improved on. The problem is sometimes, in certain cases, the therapies are worse than the problem. And I think it's all of the attraction towards blood thinners, the dangers of blood thinners in the medical legal realm that's really brought more attention to the blood clot issue, which has really been around for decades.
Okay.
It's awesome. Well,
Exciting stuff.
It is, and I'm sure working for a place like Mercy that's looking upstream, looking into ways that we can continue to improve medicine has to be rewarding for you.
Really exciting for us. All of this takes resources, and Mercy affords us, Mercy Hospital and Mercy Clinic as two distinct entities, really affords us those resources to do the exciting research that we want as clinicians, not only just taking care of patients in the day-to-day realm.
Well, hats off to you. Dr. Jeffrey Saramita, thanks to you and all the great work that your doctors and nurses do on a daily basis to deliver compassionate care to your people.
Well, thanks again for having me
Thanks for joining
this morning.
us.
All right. It's 7:30 on the Big 550 KTRS. Dan Buck sitting in from McGraw-Millhaven along with Aaron